Good morning, November 6th. Well, Biden, our vice president, is going to be the next president of the United States, as I see it. It doesn't matter. The beauty of democracy is fundamentals remain the same. As a matter of fact, it may be good because country was split. And this is the best way the democracy people can work together, come to an agreement. Sometimes divided government works better. So let's hope it benefits the consumers. Today's topic is consumers in shackles, part 2. Consumers in shackles. Yes, when it comes to healthcare, folks, we don't have many choices other than somebody is telling us what to do. I was looking at these commercials. I'm a Medicare recipient. I see we are being bombarded with commercials for the Medicare enrollment time till December 7th. One thing I've noticed, you don't see the insurance companies' names on those ads. They say, oh, you get a free eye care, free dental checkup, free medications, free this, free that. But do you ever see the name of the insurance companies who are advertising it? It doesn't say that. Oh, Medicare benefits. Call this number. But again, I love the insurance companies. They approach the consumers. They see the weakness in the consumer. But you know what? Americans are smarter. They're smarter. The way I see it, what they do is by enrolling these Medicare recipients into the fold, they're chasing after the federal dollars. Big time federal, this Medicare, pays these intermediaries umpteen amount of dollars to take care of the people. But the consumers need, I'm noticing more and more they are in shackles because once you get into these intermediary organizations, they limit your access. They say you have copays, you have deductibles, pre-existing illnesses. You're not covered this, you don't approve this, you can't see this doctor. Consumers are not going to buy that. They want freedom. They want to be free from all these shackles. Folks, there is light at the end of the tunnel, as I see it, because the one I have approached is called the light at the end of the tunnel. What I'm suggesting is health disclosure, healthy pricing, or healthcare personalized, no matter what you call it, with health solutions advantage, HTHP with HSA. It's a way to go. That's the way to go. That liberates you from all this, hoopla about, this, oh, this is not covered, that's not covered, this copay, that's covered. How you set it up, it's very simple, folks. If you're listening, it doesn't matter, you're self-employed, you're working for a small firm, you're working for a large company, you're working for the federal government, you're in Medicare, you're Medicaid. My focus is in the bottom, lower 20%. Americans are poor, they cannot take care of themselves with the day-to-day living. And my focus is on that category. 15 to 20% of Americans are poor. They don't even have the amenities to take care of themselves. But addressing a healthcare is a different ballgame. So the people who are impaired, people with chronic illnesses, that's where my focus is. instead of pooling all the entire thing and penalizing the entire, I would say, entire population. 63% of the Americans are in well category. They need to have a lowered premium so they can put money aside into the health solutions advantage. 16% are chronic illnesses. They can get the premiums lowered as long as, even though they need to, insurance companies have to advertise for the chronic illnesses category, for the well category. They need to be transparent in the premiums, but it's not going to happen unless the Congress acts on it. It's not going to happen. But irrespective of that, what I want to focus is on people who are impaired, are unable to have the health insurance. The third category is at-risk group. Again, they need to have a premium based on at-risk, what they're exposed to, like smokers and people with certain risks. They need to have a premium. I wish they have the premium advertised. The last but not the least is impaired and uninsured group. This is where the government has to focus on. I hope Biden does something. President Biden will, if the Democrats are listening to this, I'm a Democrat at heart, but when it comes to the free markets, I love the free market enterprise. This is where the country shines. And what I would like to see in the last category of impaired or uninsurable group, government has to give them life insurance, folks. They need to have 100,000 life insurance for everybody, right at the bottom. This is where the divided government, I'm sure the Republicans will agree on helping the people in the bottom get. They shouldn't have any objections in approving 100,000 life insurance policy for 15 to 20 million Americans. No questions asked. If they pass away, their close family members take that, and they can pay whatever the outstanding bills they leave behind. So that is a must. Second thing is impaired group needs a certificate of guaranteed coverage, folks. How do you set up? I see a public-private partnership is going to shine no matter who's in charge. Public-private partnership can solve a lot of things in the cities, in the urban areas, in suburban areas. Public-private partnership sets up this health review authority. Health review authority is made up of public and private, appointed by the public-private partnership. They will issue a certificate of guaranteed coverage for people who needs it, especially in the impaired group, and people are unemployed, people are not able to take us. So instead of giving the EBT cards, they can give them a Medicaid or Medi-Cal card along with life health insurance. So what this does is, and even there you can incentivize them. If you give them 5 different choices among the insurance categories, let them choose wherever their premiums are lower. Let them make the decision. This is where I would like to see that. Let them make a decision wherever they can save money. They can still put it, even on the bottom, wherever they're saving from the money from the EBT cards, they can be put aside into the personal care accounts, health solutions advantage. Health solutions advantage has to be mandated. Everybody should have health solutions advantage. This is where we can come out ahead on the healthcare delivery, and we can lower the cost. Everybody is mandated to have. So when they save the money with the lower premiums, They can put money aside into the HSAs. You need to get those 5 or 10 options where the premiums can be lowered basing on their health disclosure and healthy pricing. Basing on that, your premiums are lowered and you put money aside. It doesn't matter, $100, $200, $300. You can go up to maximum $3,600 individually, $2,500 for the family of 4. I think it's $8,400 now. So if you do that, people will have an option to save. This is where I would like to see. And it gives them the freedom to choose. So they can choose their doctor, they can choose their facility, they can choose where they want to go to get the health care. And you're not, even for Medicare, people under government subsidy, they should have the same choices, folks. They should be able to save money, put aside into the, when you're in Medicare, AARP, if you're listening, this is a best solution instead of having these ads bombarded with Medicare Advantage. There's no advantage. They're limiting, they're putting shackles on these people and limiting the services, curtailing the services, and intermediaries are making the money, folks. I would rather have seniors make and save money for their next kid and kin for whatever the needs are. If you do like this channel, hit this subscription button and notification, and we will see you. Consumers in healthcare. This is part 2, and we'll see you in part 3. Thank you for joining us. I really appreciate it. Thanks again.